For much of medical history, surgery was defined by individual mastery. Skill, experience, and judgment lived almost entirely in the hands and mind of the surgeon. While those qualities remain essential, modern surgery is increasingly shaped by something larger: interconnected systems that support better decisions before, during, and after the procedure. In colorectal surgery especially, outcomes are no longer determined solely in the operating room. They are influenced by preoperative planning models, intraoperative data feedback, postoperative recovery protocols, and multidisciplinary coordination. The result is a shift away from isolated interventions and towards system-level thinking. This evolution reflects a broader reality across medicine. As complexity increases, precision depends on structure. Surgery. As a decision system, not a single act. Every surgical case now unfolds across a continuum. Imaging, diagnostics, patient history, and risk stratification shape operative strategy long before the first incision. During the procedure, minimally invasive tools and robotic platforms allow for enhanced visualization and control. Afterward, recovery pathways and monitoring protocols determine long-term success. This perspective reframes surgery as a series of interconnected decisions, rather than a single technical event. It also explains why advances in analytics, engineering, and workflow design have become inseparable from modern surgical practice. Structured data, derived from imaging, patient history, and prior outcomes, allows surgeons to move beyond intuition toward evidence-informed preoperative planning. Predictive insights help identify anatomical variations, procedural risks, and recovery challenges before surgery begins, enabling teams to tailor operative strategies to the individual patient rather than a generalized case profile. By integrating data-driven signals into planning workflows, surgeons can reduce uncertainty, improve intraoperative decision-making, and enter the operating room with a clearer, more resilient strategy. Precision is built before the procedure begins. One of the most consequential shifts in colorectal surgery is the emphasis on preoperative optimization. Patient-specific planning allows surgical teams to anticipate anatomical challenges, assess risk factors, and select approaches tailored to individual physiology. Research and clinical experience increasingly support the idea that thoughtful preparation reduces complications, shortens recovery time, and improves long-term outcomes. This approach aligns with broader trends in minimally invasive colorectal surgery, where technique and preparation are tightly linked. Robotic platforms, advanced imaging, and minimally invasive techniques function as a coordinated system rather than standalone tools, with each component reinforcing the others throughout the surgical process. Robotics enhances precision and stability, while minimally invasive approaches reduce tissue trauma and improve visualization, allowing surgeons to execute preoperative plans with greater fidelity. When integrated thoughtfully, these innovations create a feedback loop where planning, execution, and recovery continuously inform and improve one another, leading to more consistent outcomes and reduced complication rates. Technology as an enabler, not a replacement. Technology does not replace surgical judgment. Instead, it sharpens it. Robotic platforms, real-time imaging, and analytics tools provide surgeons with more information and greater control, but decision-making remains human at its core. The most effective outcomes occur when technical tools are integrated into a clear clinical philosophy that values restraint, adaptability, and patient-centered care. Recovery as a measurable outcome. Postoperative recovery is now viewed as a core measure of surgical success. ERAS protocols, early mobilization, and data-driven monitoring have transformed recovery into a measurable extension of the surgical process rather than a separate phase. Structured recovery pathways combine pain control, nutrition, mobilization, and monitoring into a consistent system that reduces complications, shortens hospital stays, and improves long-term outcomes. By analyzing recovery data, surgical teams continuously refine future planning and patient care. The future of colorectal surgery will depend not on one breakthrough, but on how effectively planning, technology, execution, and recovery are integrated into a unified surgical system. This systems-based mindset encourages consistency without rigidity and innovation without excess. It recognizes that precision emerges from coordination, not complexity for its own sake.